Welcome to the Microscopic Minute. I'm Dr. Kate Baker, a board-certified veterinary clinical pathologist on a mission to help veterinarians feel more confident at their microscope.
I'm going to tell you one of the most important concepts in cytology in like 30 seconds. I'm going to show you this case and then I'm going to explain what I mean. So this is a case that I was just sent for telecytology. I'm helping this vet with this case. They sent me pictures and I'm looking at it. This is from an older dog with a mass. And I have a set of photos here, but here's one of the photos, right? And what cells do we see? So we see cells that are spindle shaped, right? So we've got these long wispy tails. These are mesenchymal cells. There's 3 of them. They have some atypia, prominent nucleoli, all those things. Okay, so is this a sarcoma? You know, these are atypical spindle cells? Maybe, but I want you to tell me as I scroll through these pictures, what the very most important picture in this set is. I mean, they're all important. This is an important thing to see. I want to be able to see up close. I want to be able to see the details of these cells. But I'm going to tell you that the most important picture in this set that I'm sitting here holding my breath, hoping that this vet included, which they did, is this one. Why? Now, this is a low objective photo. So sometimes on some microscopes, low objective photos, the cells can be really blurry, so we can't really see them. But in this case, I can see them well. And why is this the most important photo here to be able to understand the importance of those spindle cells? Because I can see all the cells in here, and there's so many cells, and they're all spindle cells, which I know you may not be able to see just from this video, but the point is that I can see the context now. Listen, the number one most important thing, I think I would put it number one, is context. Cytology is all about context. We can't look at like a few cells and make a diagnosis because it's all about the context of the cells there. So in this case, because all of the cells are spindle cells and there's no inflammation, that makes me think this is going to be a soft tissue sarcoma in particular. That's other things about this make it a soft tissue sarcoma in particular. But the fact that there are so many of these cells and there are no other cells on here, now I have context. So I can call this a sarcoma. Now, why might this be an issue just looking at a few spindle cells? Why can't I call that a sarcoma? Because guess what? Reactive fibroblasts can look like that too. And where might you see reactive fibroblasts? Everywhere. You can see reactive fibroblasts in inflammatory lesions. You can see them in mast cell tumors. You can see them in other types of tumors. So if I'm only looking at a few of these cells and I don't know what else is there, then I have no context. So I have to have the company they keep context. Who else is present? Hugely important concept in cytology. Huge.